Hello, my name is Oscar Villada. I'm a student physical therapist assistant, and today we're going to be going over neuromuscular electrical stimulation, or you might have heard of it being called Nmes, right? It's pretty popular in the outpatient clinics, right? And the reason why these are used, it's used for muscle strengthening, muscle re-education, muscle guard slash spasming, and it's even used for edema reduction, right? Um, so this is what it would look like. It comes in a box. You take it out of the box, and this is what you'll see. Um, it's not turned on yet. The way you turn it on is you see these two knobs. So if you turn this one on, this side will turn on. And this is measured in milliamps, right? So this is the intensity, and this is going to be also dependent on the patient, right? Um, so you're going to go ahead and open it, right? And then once it's open, the battery isn't in it, so you'll have to place the battery. I already put one in it, so there's the battery. So once that's in, it should have its energy source, right, to be able to use it. So this is also has different knobs, different settings. I'm going to go ahead and maybe that'll focus a little bit more. Maybe. All right, so this is going to be the contraction time. This is going to be measured in megahertz, and that's the frequency. And you would always want it to be between 30 to 100. There's different devices out there, and depending on what you want, right, you would want it to be at least 20, no less than that. And if you want it to be used for muscle strengthening, it has to be greater than 80. So this device in particular doesn't have an 80 option. It's just, I believe it's 5, 30, and 100 megahertz, right? So it's always going to be in the middle, at least at 30. There's also a ramp time here, and there's also a relaxation time here. So the reason why there's a ramp time is because we don't want the muscle to go into an instant contraction, right? We want to kind of let the muscle kind of ease into it and then contract, right? So it'll take 3 seconds to get that contraction going, and then 3 seconds to let go, right? So yeah. So as we proceed, for the most part, you're gonna want it to be a 1-to-1 ratio, right? Depending on what the goal is, right? If it is muscle strengthening, you can do 1 to 3, right? Or it's be 10 seconds on, 30 seconds off, right? And you would want to do it for a total of 10 to 20 contractions, right? Or 10 to 20 minutes. If it's muscle re-education, muscle guard, spasm, or even muscle guard, spasm, and muscle re-education, you would want it to be at least 1-to-1, right? You can also have a setting for muscle re-education for 1 to 50, so it'd be 10 seconds on, 15 seconds off. It just depends on the clinician as well, and again, for the overall goal of this device, right? So with that being said, we're going to continue on. You're going to need the electrodes that it comes with, right, that your clinician will provide for you. He's being used for it, right? And so with the electrodes, what you want to do is to place them on the muscle bellies, right? So we're going to do the wrist flexion for today, and I'll show you guys where I'm going to place them. So with that being said, you're going to also need the wire that it comes with, right? And then these two go to the electrodes, and then this one goes into the device, and I'll show you that to you guys as well. Okay, so I'm going to go ahead and do this side. Okay. Go here. And again, the overall goal for the most part is for muscle strengthening or muscle re-education, and it's basically just getting the muscles to be able to fire again the way that it needs to, right? Especially if a muscle has been immobilized for a cast or a splint or anything like that, that's been immobilized for too long, it atrophies, right? And so therefore the muscles are weak, right? And we want to get them to get stronger again, to activate the way they should be. Yeah. So as we continue, we're going to do wrist flexion. So I'll place them here, and I'll show you guys. So we're going to go ahead and take the electrodes. And again, the machine is not on, right? So we're going to place them on the muscle bellies. right? And you don't want it to be too close, right, or too far. You want it to be pretty at a good distance, right? So again, just at the muscle bellies. So here, right? So now they're at the muscle bellies, right? Because the electrodes also gives the area, the surface areas that covers it, right? So this is the area that will cover it. This is the area that will cover when the device is on, and you guys will see. So right now, my setting that I'll have it on, if it opens, there you go. Okay, so what I'm gonna do is I'm gonna do about, it's about 5, we'll do 5 and 10. So 5 seconds on, 10 seconds off. All right, and then we'll do 30 megahertz. So that'll be the frequency, and then the ramp time is gonna be at 3. Okay, so yeah, everything's all set. Hopefully you guys can see that. It's a little better. Maybe there you go. Okay, I'm gonna go ahead and turn it on. Again, it's not on, and the way you know it'll turn on is that button's on, right? But then this little button too will also turn on. So I'm gonna go ahead and go up with the amplitude a little bit. Okay. So right now it's in the off setting, and the way you want this to work is to have the patient work with the current, right? Because this is sending electrical signals to your muscles, and then yeah, you want to teach them to, once they feel the contraction, to go with the contraction, right? So you're gonna feel a little bit tingliness, right? A little bit of, not shock, but just a little tingling, mainly. It's like a, I would describe it as like almost like a pulse. So right now it's on and off, right? So once the patient starts feeling the stimulation from the electrodes, right, they would want to go ahead and start contracting on their own, and then relax. So right there is contracting, and then relax, and then we can do it a couple times, just so we can see. And I've also done it a couple times too. So there it is, and relax. Right. So one thing that I did not mention is that the pulse duration that's measured in microseconds, and typically it's between 300 to 600 microseconds, but this device itself is preset to 250. So you can't change that on this device, but there are other ones that do have that option, and you would want it to be between 300 to 600 microseconds, right? And then the amplitude, right, is this little knob here, just like I mentioned before, but the amplitude itself is dependent on the patient as well, because in reality you want them to be able to feel a strong contraction going on, right? And depending on how atrophied that the muscle is, or how weak that muscle is, it might not take much for them to feel that strong contraction. But again, the main point is for the patient to go with the current that's going, right? And yeah, that's pretty much Nmes. Again, its purpose is for muscle strengthening, muscle re-education, muscle guard or spasming, and even edema reduction, right? It just depends on the parameters that are being set. And then it has its on and off times. It has its ramp time. Again, the ramp time, you want it to be between 1 to 3 seconds, because you just want to gradually go into the contraction, not go into an instant contraction, right? And yeah, I think that's pretty much covered everything, right? And then you can go ahead and turn it off. I'll go ahead and turn it off. Cool. So that's Nmes right here. And again, this is used for patients to basically be able to contract their muscles again, right? And it gives them signals, if you will, to go into contraction. But yeah.